So before I get this patient up and moving, I would want to check his vital signs first. So I'd go in and I'd check his blood pressure, check his heart rate, check his O2 saturation with his pulse ox, and I can also check his respiratory rate as well, just so I can make sure that he meets the threshold to get up and moving, just moving around bed, but also it gives me values that I can keep track of as I'm moving this patient as well. Then I want to move on to his ventilator settings, and I know these values like the FiO2, the PEEP levels are all in his chart, but this is still a priority for me because I need to ensure that these levels are improving, because that just makes it known that his respiratory status is improving as well. So that's something I want to keep an eye on. Checking his lab values too, so his ABGs, like his CO2 levels, pH levels, PaO2 levels. Again, it's going to give me a good representation of his respiratory status, his respiratory compromise, just to ensure that he's fit to move around. And it gives me good values to keep an eye on as I am moving him around, to see if there's any changes that may indicate that he needs to be stopped. Lines, leads, and tubes are important. I need to know what kind of arterial lines, central lines, catheter, his mechanical ventilator, IV, anything along those lines that I need to know how to manage as I'm moving him around. Or it gives me a good idea if I need additional help as well from any type of other therapists or any assistance, if I need any other members of the healthcare team in there to help me out. And then medications, of course. So if he's on any vasopressors or whatever sedation medication he's on, how often that's coming on, when was the last time he had it done, because that may affect how I'm able to move around, if he's able to communicate with me at all. Gives me a good idea, and that also will help me confirm his sedation status and his scale, his agitation scale. And then also just quickly checking, like using the Wells criteria, checking for any type of DVT that might be present, just so I know it's not a contraindication for him to move around this early.